Hi everyone, and welcome to our 2020 SUGAR Expo. Imagine taking a pen to write something on a paper. How many times do you do it during a day? For people suffering from inflammatory rheumatic diseases, a simple action like that can be very hard and painful. This is the daily reality of Claire, Rebecca, Vivian, Louisa. They're part of the 23 million people around the world who suffer from chronic rheumatic diseases. These are silent and painful degenerative conditions that can cause permanent and invalidating damage if not treated on time. Only in France, where we mainly conducted our research, these patients represent 1 to 3% of the population. Medical developments have fortunately contributed to create treatments and procedures that can stop the progression of the disease and greatly improve the patient's well-being. But still, a great amount of people get a late diagnosis and have to deal with the consequences. This is why the pharma company UCB and the hospital CHU de Reims challenged us on optimizing the overall patient journey in order to reduce the diagnosis time in France. During our research, we talked to many patients, and one of them was Claire, a 30 years old nurse that started suffering from back pain at the age of 18. It took her 7 years to be properly diagnosed after visiting many specialists. She had struggled being understood by doctors. She even felt no comprehension and some apathy from them. According to her and many other patients, lack of communication between doctors and patients is what makes the whole process even harder. We realized that we could lend a hand to these patients by helping them to better express their feelings every time they speak to a doctor. For that, we created Symptometer, a mediation tool to help patients to communicate their feelings in a more visual way. You can see more about it on our website.
But looking closer, we realized that we had to go deeper. And in order to create a systemic solution, we needed to understand the doctor's side as well. In France, a patient needs to visit a general practitioner first and, if needed, be referred to a specialist. The problem is that usually these professionals aren't in the same network. That's the case of Jean-Louis, a rheumatologist at the CHU de Reims hospital. He's a specialist in inflammatory diseases, but GPs often send to him patients with pathologies that could be treated by other doctors. At the same time, his agenda is busy for the next 6 months, even though he makes some space for urgent requests. Pascal, on the other hand, is a GP. When he has a supposition of a diagnosis, he needs to contact a specialist for urgent advice or even a consultation. If he doesn't have any connection, it becomes hard for him to make it quickly. Therefore, his patients need to wait up to 6 months to have a visit and eventually a diagnosis. This is why we developed Dauda, a platform to bridge the communication gap between GPs and specialists. Because we truly believe that connecting doctors is the key to improve the patient journey. This is how it works. GPs can search according to specialties and types of consultations that they need. They can even have better search results by applying filters like pathologies, location, and sectors. With that, Dauda provides a list of the best doctors and also how to contact them. Doctors that are testing our platform are telling us that this is an innovative way to connect professionals. As the rheumatologist Amber has said, we offer a lot of possibilities to get in contact with doctors that she didn't know before. More than that, we realized that this isn't an exclusive problem for the rheumatology areas. We understand that the challenge of providing a good and fast diagnosis is not only for rheumatologists, so it would be important to have all the specialties in the platform. We believe that our service, if extended, can have a real and positive impact in the healthcare industry. That's why we envision a future in which we are able to connect many more professionals. We are students from Politecnico di Milano and d.school Paris, and we would like to thank you for your attention.